Hi everyone, my name is Julia Tang. I'm a physical therapist at Breakthrough Physical Therapy, and today I wanted to show you some of my favorite exercises for individuals with knee pain. So personally, I had some knee pain starting in college. Initially, I was a swimmer throughout my childhood growing up, and then when I went to college, I decided I wanted to play ultimate frisbee, and turns out that my body really doesn't like dry land. But the game was fun, so I wanted to keep going. And so I was shadowing a PT at the time, and she gave me a few exercises to try. And then I was also part of the sports medicine internship at UCLA during my undergrad years. And through that, I learned from the physical therapists and athletic trainers there some other exercises that I really like for people with knee pain. So here's just a group of a few exercises that I really like and that have really helped me throughout the years manage knee pain while still doing a sport that I love. So hope it helps you too. So before we get to the exercise, a little bit of introduction on what we're really working on. A lot of times we get knee pain because we're lacking in knee stability. And knee stability actually comes from the hip. So a lot of the muscles we're going to be targeting are in this area of the hip, kind of your butt and the side of your butt or your hip here. And these muscles are your external rotators, which open your hip up, and also abductors, which bring your leg out to the side. So a common cause of knee pain is when you're doing squats or landing or jumping, your knees kind of cave in. It's not great alignment for the knee, and you can see how this would start to hurt over time, puts unnecessary pressure on various parts of the knees. Also, a lot of people tend to be very quad dominant, always initiating, coming down to the ground, towards the ground with the knee bending, where we really want to promote a nice hip hinge so we can access the power of our glutes back here, okay? So even though this abduction doesn't really look like a functional motion, when you put this foot on the ground, abduction is going to prevent you from dipping in or prevent your knee from dipping in. So we're really working on those glute muscles to help improve our knee stability and reduce knee pain. So the first couple exercises are going to be down here on the ground. So we're really going to target those glutes and those hip external rotators first. So the first exercise is going to be a clamshell. You can use a resistance band, or you can just do it with your own body weight if you don't have a resistance band. So for the clamshell, I'm going to put this band around just above my knees. You don't want it right on your kneecap because that can kind of rub and be uncomfortable. And you're going to lay on your side. Important things here, you want your hips to be totally stacked, core engaged. You can put a pillow under your head or just support it with your arm. You're going to have your knees about 90 degrees bent and hips about 45 degrees bent as well. So the exercise is you're just going to open up like a clamshell. So I like to put my hand on my hip so I can feel that I'm not rocking backwards, because that's not using your muscles, that just uses your body weight. And also I can feel these muscles in here activating underneath my thumb. There are some variations. You can bend your knees a little bit more, bend your hips a little bit more, bring them a little bit further back. But the important points are keeping your hips stacked. Don't let yourself open so wide that you rock all the way backwards. You only have to open up about 45 to 60 degrees here, as you can see. And you should be really feeling it in those glutes. Okay? So, the next exercise is going to be a glute bridge. So a glute bridge is fairly basic exercise. You lay on your back and then just lift your hips up. But important points here, you want to engage your core. So your stomach is, draw your belly button slightly towards your spine, because you want to avoid arching through your back here. That's just using your back muscles, not your glutes. Also, push through your heels. So sometimes it helps if you just lift your toes off the ground a little bit to really squeeze those glutes. You want your hamstrings kind of loose here. You shouldn't be feeling like your hamstrings are rock solid. So you're really squeezing through the glutes and not too much activation of the hamstrings or the low back. To make this a little bit harder, you can do a single leg glute bridge. So I usually lift one leg, keep my thighs parallel, so we get a little bit of a quad work in there too. Keep your hips stable, nice and level, and then just lift up. Same idea. And try and keep your thighs parallel throughout the motion. So just showing you from the other side. Still trying to squeeze the glute here. Your core has to work much harder to keep your hips level and try and keep your thighs parallel. Okay? Okay, so for the next exercise, we're going to bring that band back. And this is going to be a side step. It's really working on those hip abductors. So I'm going to step into this band. And we'll start with it just around my knees, the same place that it was for the clamshell. What you're going to do is going to get into a mini squat just to activate the glutes by pushing your hips back. And then you're going to keep your feet pointing straight forward, hips level, and just step to the side. So important things to think about here. You can do this wherever you have like a hallway or just back and forth across the room like I'm doing here. So important things to remember are you're not doing a dance. It's not dance class. Keep your hips nice and level. And also keep your trunk upright. So one common tendency is for people to really rock their body back and forth to counterbalance their leg. You want to keep everything from the waist up totally still, really driving from your hips. To make this harder, put the band farther down your legs. You can go just below your knee, down your calf, or down to your ankles, or even around your feet. So this is going to increase the challenge. Another common thing is people start to go toe out, and that really works the front of your thighs, and we want to work the side. So make sure your feet are staying straight forward here. Okay? And also control the step out and the step together. You want a little bit of tension on the band at all times, and don't let your foot drag. So control step out, control step together. Again, I like to put my hands on my hips to make sure everything is staying nice and stable. Okay? So that's the side step. So the next one is going to be a squat. So there's many ways to do a squat, but there's a few basic principles that we always want to follow. You want your feet about shoulder width apart, maybe a little bit wider. You want your knees tracking over your feet. So for a lot of people, that's very, very slightly toe out, and you just want to drop, push your hips back, and drop into the squat. Okay? So really important as you're going down, don't let your knees bobble, because that bobbling is uncoordination, and that's what can contribute to your knee pain. So really squeeze those glute muscles that we were just working with those side steps to keep your knees nice and in good alignment. The other thing is you want to initiate with a hip hinge. So push your hips back first. A lot of people go knees first and then end up here. So hips back first. Try and mimic your chest angle with your shin angle. So they should be about the same. Again, keeping your core tight. And just come down to about 90 degrees. If you're having a hard time getting down, or if you really feel like you're having a hard time pushing your hips back first, sometimes it helps to sit back to a chair. So you can just put any chair, stool, do it to your bed, something that's stable, and you can just reach your hips back to tap on that chair, or if you need a little bit extra help, you can sit all the way down and then stand all the way up, making sure you get all the way vertical at the end of each squat. Okay? So those are a couple of the variations on the squats. So the next one that I really like is a lateral lunge. I like it because it works kind of those side-to-side motions that a lot of athletes need, and also works in that side-to-side direction, especially like runners. Runners only go in one direction, so I kind of like getting people out of that forward back motion and a little bit into side to side. It really gets those hip abductors working and really helps your glutes activate. So for the lateral lunge, you put your feet about double shoulder width apart, and you're going to pretend your hips are on a track, just sliding forward and back. So you sink down to one side, sink down to the other side. Again, initiating by pushing your hips back, Keep your knee as much as you can behind your front toe. And you want your hips to be in alignment with your knee, which is right over your foot. So you're just pushing straight back. So from the side, you push back here. And so you want to initiate with your hips pushing back. Okay, so sometimes it helps just to stand next to a wall and then try and tap your hips back on the wall. So here, you just reach your hips back, tap, come forward, reach your hips back, tap, come forward. So just having the goal of tapping something behind you helps you shift your weight back a little bit. So moving on to one of our most advanced exercises here, this is going to be a single leg squat. So the single leg squat is going to require balance on one leg. It's going to require a lot of knee stability coming from the hip strength. And it's just going to require a lot of coordination for your muscles overall so your brain knows where your body is in space. Okay? So there's a few variations. There's a couple I usually like to start with. You can put your foot in front and do a squat down, kind of as far as you can. Or you can do a runner squat and bring your back leg, kind of your shin parallel to the ground, squat down as far as you can, and then come up. Okay? So for both of these, really important that as you're squatting down, your knee's not going all over the place like that. So activate your core, activate your hips, make that knee nice and stable there. And if you take a tumble, that's okay. So try that again. So nice and stable coming down and coming up. Okay? So that's the single leg squat. To step it up a little bit, get a little bit more balanced work, you can do it 4 ways. So try with your leg forward, and then lift your leg out to the side, and then bring your leg back, and then bring your leg kind of inside to the back. So kind of working in all 4 planes there. This is really going to work on your balance, your single leg strength, hip stability, and it's really good for overall knee stability. Okay? Because when we're out there playing sports and you're trying to land a jump or, I don't know, make a cut or something, you don't know that the ground is going to be perfectly set up for you. You're probably not landing from a straight-on angle, so I really like working all these different directions, especially the side-to-side directions to build up that hip strength. Okay? Okay, thanks for joining me for that. That was just a little smattering of some of my favorite exercises that I like to use for people with knee pain, including myself. A lot of people ask, like, how many should I do of these? Realistically, some of the lighter exercises like the clamshells and the side steps, those are a little bit more activation exercises, so I like to do those more every day or like 5 or 6 days a week. You can give yourself a break day, like on the weekends or something. For the heavier exercises, if you're adding weight to the squats or the lateral lunges, and especially the single leg squats, those I like to do every other day just to give your muscles a chance to recover in between each session. And how many you're doing really depends on you. You want to have good form. So if you notice that your form is starting to break down, if you're starting to like sway around a lot, or you're just really using momentum to push through the exercises, then it's time to take a break. You do want to push yourself, but you don't want to push yourself so hard that your form breaks down. So typically a good starting point to work on strength is 2 to 3 sets of about 8 to 10 repetitions. Or if you're going more for endurance, you do closer to 2 to 3 sets of 12 to 15 repetitions. But that's just a guideline. The most important thing is your form. And so as long as you're doing these exercises with good form, that is the most important thing. Okay? So thanks for joining me today while we talk about my favorite exercise for knee pain, and hope to see you again soon.